Thank you, ma'am.
All right. Okay, so at 12:02, and we're going to go ahead and call this meeting to order. Do I have a motion to begin?
No motion needed.
Okay, and a second?
Second.
All right, motion carries. All right, so at this time, we'll take any public comment. And does not appear that we have anyone here
There's none signed up.
and none signed up. Okay. So I guess at this time, we'll go ahead and move into our consent agenda. Do I have a motion to start the consent agenda?
I'll make that motion.
All right. I second. All right. Motion carries. All right. Consent agenda item A. Considering approving the August.
I'm sorry. Was
August.
that a motion to approve the consent agenda?
Yeah.
Okay,
Sorry,
then you
my
would
bad.
move on to 4A if everyone's satisfied. If
Yeah.
it's a motion to approve the consent agenda, then all items listed on the consent
Yes.
agenda would be.
Sorry, my bad. Now on to regular agenda. Do I have a motion to start regular agenda now?
No motion needed. You
All
can
right.
read the agenda item.
Okay, so regular agenda, item A, committee member orientation and presentation made by Assistant City Attorney Kathleen,
Dabbert, thank you.
Dabbert, okay.
Yes, thank you.
Okay, good deal. Just wanted to make sure I got it correct. All right. Okay.
If I may, you all, if I may have the presentation from right here, if that will be fine. All right. So I am Kathleen Dabbert, as indicated, and I'm one of the assistant city attorneys, and I'm here to provide some orientation and so that we can share with you some resources that might be helpful to you in terms of your role as committee members. And if I may start off first sharing that I am grateful and thankful to you all for serving our community in this role. And so I hope that these resources that we review today will be helpful in your role. As I was working on this presentation, I was focused on the slides that we will go through. But this morning, as I was drinking my morning coffee and preparing for the day and preparing for the time that I was coming before y'all, I was drinking my coffee and the dog in the neighborhood was barking. And I thought how very appropriate for me to experience this as I'm drinking my coffee and reviewing the highlights. And so as you'll see, we are going to review some of the resource information that I have prepared for you in the presentation. But I also wanted to share with you some of the topics that I hope are highlighted during this presentation as I was sitting there this morning making sure that I was covering some of the topics that I was reviewing in terms of being a part of all of your meetings as well. One of that is that the notice of the meetings are 72 hours, as you will find in the Texas Opens Meeting Act information. Also, that there is a quorum that needs to be established before the meeting is conducted. And I believe that that was also discussed at the last meeting in regards to the quorum in the bylaws, which you also have already become familiar with, are the bylaws that are pertaining to the City of San Angelo Code of Ordinances. And also in regards to the public comment section, which is also from the Government Code or the Texas Open Meetings Act, of which you have also probably already become familiar with some of the changes that have been involved in the open comment. So you have already become familiar with a lot of the information, and so we're here to move on now in regards to some of this information. Some of the topics that we will be reviewing that are relevant to your role as a committee member board meeting are there. And we begin, maybe if I may, with the Health and Safety Code section 823.005. And as indicated there, basically must be composed of at least one licensed veterinarian, one county or municipal official, one person from the animal shelter, and one person from an animal welfare organization. The advisory committee shall meet at least 3 times a year. All of this information in the Health and Safety Code, if you search on the internet under Texas statutes, and in particular the Health and Safety Code, you will find the information under Chapter 823, Animal Shelters. Moving on, if we may, under the relationship of statutes, Texas Health and Safety Code 823.005, of which we already went over, you'll see there in particular, there's also the Health and Safety Code Chapter 826, as well as 829 that is referenced. The reason for that is if you will review under the Health and Safety Code, under the Texas statute information, specifically under Section 823.003, it states that the areas that the advisory committee that are to review under this chapter in particular deal with the housing and sanitation as provided in Chapter 826 for quarantine and impoundment facilities, and 2 animal control officer training adopted under Chapter 829. And so that is why that is also referenced. As well as there is some additional information under the Texas Administrative Code as indicated on this slide under the shelter rules. Now, as you already became familiar with locally, we have, as you were reviewing the bylaws last time, our City Code of Ordinances, identified as the Code of Ordinances, City of San Angelo, Texas. There are 2 areas that mention your role as an advisory committee here. One is under Chapter 2, Article 2.07, Division 1. This would give some general information in regards to the advisory boards in general. The second, as you'll see specifically right now, if you go to the website under the City of San Angelo Code of Ordinances, Chapter 2, Article 2.07, Division 13. On the city's website under the Code of Ordinances, Division 13 is the area that discusses the particular role here that we are here today, the Animal Shelter Advisory Committee. And so feel free to look on the City of San Angelo. You probably already are familiar with that, but just so that you know, and as we're discussing this in a public forum, that information, as well as the Chapter 3 identifies the animal control. The Texas Open Meetings Act. Now, this is the part that we are going to also focus on in regards to the rules that we already highlighted in regards to a topic that stands out. Notice 72 hours, giving notice of the meeting. There is also information under the, where the Texas Open Meetings Act, a lot of the information comes from is the Government Code, Chapter 551. Open meetings. It gives definitions at the beginning, such as 551.001, deliberation means a verbal or written exchange between a quorum of a government of a governmental body or between a quorum of a governmental and another person concerning an issue within the jurisdiction of the governmental body. All of this information if you go to the Texas Attorney General's Office website, Open Meetings Act, there is that training that you can take, and you can take the training and also receive the certificate, as well as you might also want to review the information in regards to the Public Information Act, because the Public Information Act might also be something that you might want to become familiar with in your role. In general, when you review the Texas Open Meetings Act, the general rule is every regular, special, or called meeting must be open to the public and comply with requirements of the act. Cannot convene a meeting without quorum. Meetings require proper posting 72 hours before the meeting. I'm just reviewing some of the information in the government code that might need to be highlighted. I think that we have discussed a lot of it as the general rule is. But again, I encourage you all to go to the Texas Attorney General's Open Meetings Act website information and take the training video. I find that very valuable and helpful information, as well as review the Public Information Act information on there as well. So that is really what we are focused here as your role in regards to finding out some of the rules and regulations in regards to this subject. And again, those resources are our own website that provides the information, which you've already become a lot familiar with, as well as that Texas Administrative Code that we reviewed, just for some information, and particularly the Texas Open Meetings Act, which we're very grateful that the Texas Attorney General's Office has posted that training video for us to watch as well. Does anybody have any questions or? Okay. And forgive me if you already knew all of this information. It sounds like, from hearing the discussion at your last meeting, that you all are very familiar with the process. So thank you for your patience while we just reviewed that together.
Thank you. All right. So anyone have any questions or discussion about that you want to have at this time?
Well, I don't have a question about that, but I do have a
You do.
question. I just have a question, and this is my second meeting, so I'm still newbie. In my first meeting, you didn't put the monthly performance letters in consent agenda. This month you did. So basically, when we voted on the consent agenda, those were included, and so my assumption, they're not going to be discussed now? Is that correct?
Right, we wanted the bulk of our time today to be available for Kathleen's orientation. And we could have moved them off consent agenda before they were approved. I don't know that we can do that now.
No, you can't do it now. That's my question. Is that going to be the way it is in the future, that they're always going to be on the consent agenda?
No, it was in the intent of giving Kathleen ample time for orientation today.
Okay.
No. They've for the last many years, I've always been on that. And for today, like Morgan said, the focus was on some orientation.
Okay, I should have paid better attention, but I wasn't. So all of a
That's
sudden, I
okay.
realized it's on the consent agenda and we're not going to discuss them. And it being my second meeting, I'm still trying to find my way
No.
as to what our role is.
Sure.
So, thank you, Kathleen.
Okay, all right. Is there any public comment at this time?
There's none signed up.
Okay, all right. So we're going to go ahead and move on to follow-up administrative issues. We're going to go to discussion and possible action related to future meeting dates in 2025.
As Kathleen mentioned, we're required per state health code 823 to meet at least 3 times annually. Staff proposes meeting 4 times in 2025. At the conclusion of each quarter. So we do report monthly, but just to have 3 months' worth of data for each meeting, we recommend meeting the third Thursday in January, April, July, and October. So those dates are in your background, and if they're agreeable to the group, we'd recommend a motion to approve those meeting dates. And of course, additional meetings could be called as additional topics come up or anything time-sensitive can be referred to the chairperson, and that person can call for a meeting, set a meeting, and we'll publish it with the 72 hours as required by the Open Meeting Act.
I don't have any problems with the dates or the amount of meetings that we're gonna have for next year. Historically speaking, having a meeting monthly was not as productive. Even the bi-monthly meetings, it seemed that the meetings were very, very short, majority of the time, and also the attendance was quite scarce. So the once a quarter seems to have had better attendance and also more substance. So that's how I agree with that.
I'm inclined to disagree with you. I realize that there's a lot of new membership here, and we're finding our way through the process. And our role here is very important. It is or frankly, we wouldn't be bothering with it. I think at our last meeting, we had a casual conversation about maybe a bi-monthly meetings through the course of going forward from here. I've since thought about that. And with the temporary facility being built and the amount of time investment and money investment that's going into that, I'm kind of moving to the conclusion that I think we need to go to monthly meetings. I mean, I'll show up.
I'll show up.
And to be honest with you, it really depends on, sometimes I'm able to show up. There's things that, take precedence. This is, I do come to these meetings to be a voice and to give guidance. But from time to time, especially during the summer months and springtime, there's things that come in to the clinic that are sick and injured, and I'm unable to attend on some of those. So, I've also at the other location that we usually have this at, when the doors shut at 12 o'clock, 12:05, and sometimes I'm, skating in, trying to get there about 12:15. Sometimes, I can't get a hold of someone to get me inside the building at that point either. So, while monthly meetings do seem nice, I mean, there are some meetings that I may or may not make just because of other commitments.
Well, not to be contentious about it, but.
I'm just telling you that's kind of
What
on
I'm
that part.
hearing is that you don't have time for an hour a month. And bluntly, if you don't have time for an hour a month, you're overwhelmed.
When a dog walks into my facility to be cared for, if it's at 12:15 or at 11:30, sometimes my other doctor he's not there. He has another life, he does other things, and if that animal does take, care takes precedence over that. And that's just kind of what I'm trying to be informative on, is that, I take care of medical concerns for people's animals, and that's just on that part. But I will tell you that historically speaking, from seeing this board operate for well over 7 years at this point, I will tell you that monthly meetings have very poor attendance.
Well, I think that probably we're going forward, not backward. And I think.
I will just leave it at that as a historical standpoint. I'm not saying that going forward it might not be different, but I am going to go forward with the other part of this, that if you look from history's past with various members on the board at various times, I'm just going to tell you that there is a chance that even though there's monthly meetings are occurring, that's that. And as of right now, we're at our quarterly meeting, and the last 3 quarterly meetings, we've had one gentleman show up consistently. We've had maybe 2 people before that, and there's not anyone here to give us feedback.
Well, but we're here. I'm assuming that the role of the advisory committee is to advise and offer direction to Morgan and ultimately out to PAWS, because Morgan works directly with PAWS, and they're an integral part of this entire organization. The purpose of the meeting is for us to come to a consensus, not so much to make a public presentation, although the public presentation is important.
And unfortunately, I mean, I've looked at the bylaws, the 3 of you, I mean, Morgan works for the city, you're under contract with the city, you're under contract with the city, so you're a vendor, I guess, for the city, and maybe serve in another capacity. Also, that gets kind of complicated when you're also voting on this board, so you 3 have other relationships with each other where maybe you learn things or you know things or you exchange information about what's going on, that we as these members, we don't have that same relationship with y'all. Like, if y'all talk you talk to Morgan about, what's going on at PAWS, or you talk to her about what's going on at PAWS, in y'all's official capacity as the vet and as PAWS, we don't have those same opportunities, I guess, unless you want me calling you every week, which you probably don't. But again, and to go back to what he said, I appreciate that you're busy. I know you're busy, you're a vet, and you used to be my vet. So, I mean, I appreciate how busy you are. But if you're that busy that you can't do 1 hour a month and somebody isn't here to back up, like an assistant chair or someone else on the board that can stand in, and maybe that's not in, I didn't see where that was.
The
but-
reason why I was put to this position is because the previous chair was getting off, and there were no other people to select it.
Okay.
Majority of the time that I've been on this board, I've not been in chairperson position at all. And there's been various times where I have either tried to recuse myself on anything that seemed anywhat conflicting, because I do not want to be viewed by that. I have asked staff, for guidance on things that I saw on consent agenda to see if I should be voting or talking about it. I have contacted that various times. And as a historical note, many of the previous shelter veterinarians that have been underneath contract to be the veterinarian on record have been on this board as an advisor at some point during their time. And it's not that the veterinarians here are either uninterested or not desire or do not wish to be here, or they have other things. So veterinarians in general do try to be on that. And during the years when we, through 2020 through 2022, there were a lot of things that kept us, having other things to deal with. So we do, well, from my point, I do respect your desires. I'm just giving feedback from watching previous sessions, before Morgan, before I was here, it's been long enough, I've forgotten his name. And when he was there for 2 years prior. So it's not that I'm going to tell you that it won't happen or it can't happen. and the lights got dark because no one was moving. The, you know, if the board wishes to do bi-monthly meetings, I think there's definitely enough material on the consent agenda for discussion at monthly meetings in years past. And I'm going to tell you that for 5 years, I watched the monthly meetings, and they lasted maybe 15 to 20 minutes at the most. And it wasn't an hour. And then there were times when there was a room full of people here, and I was one of 3 people to show up that day. And I had to get up because the board person wasn't there, the chairperson, vice chair wasn't there. And I had to tell these people that wanted to discuss about a dog that had died underneath certain circumstances, that all wanted to give public comment, that we couldn't meet in a quorum. And I got a large amount of angry stares and people saying, why can't we have? And unfortunately, we couldn't meet that day. And the people that didn't show up were all very aware of the public comments that were coming. And there was only 3 people that showed up. And I have watched attendance rise, I've watched attendance dwindle, and I have seen people come with comments regarding shelter improvements and things of that nature. We've also made recommendations for city improvements to the council. The continuous one that is continuously recommended to the city council has been additional ACO funding. We have had many on that. So we do have a lot of comments that we make. We have made suggestions in the past, and a lot of them have not been able to be done for various reasons. So I do feel that if you do wish to do monthly meetings, you'll have to get the consensus of the group. I would not consent to more than bi-monthly just because I haven't really seen the amount of material discussed to be discussed on that. So bi-monthly meetings would be more than adequate, but monthly meetings, they don't end up with enough material. And that's just the truth. And they did monthly meetings for about 3 or 4 years.
Well, and I think the intent of setting the calendar today in October of 2024 is so folks can plan ahead for their 2025 schedules. And so I think getting this feedback and clearly communicating what's the committee's desire is the best way for folks to arrange for coverage and plan their schedules around. And so certainly any motion from the committee for the rest of the group to weigh in on would just set what the 2025 calendar is going to be.
Well, I think maybe that your comment about not enough information, not enough dialogue on events happening or what's going on with the shelter, or its relationship with PAWS. I think maybe that's limited. I think there's probably a lot more to talk about if we're willing to do that.
And I think in the past, we've been curtailed by what our purview is under state law, that the pause agreement, rescue activity are not things that traditionally come to this committee in the laws that Kathleen was referring to.
Well,
And so that's why we wanted to have an orientation today to really understand what this group's role is. So that's part of what's driving that, but certainly, staff will support whatever the committee agrees to today for whoever wants to make a motion for what the calendar should be for 2025.
I think meeting in the middle and doing bi-monthly would satisfy for at the least the time being.
What was that, ma'am?
I said I think meeting bi-weekly or bi-monthly would probably satisfy at this time.
I agree.
Yeah.
Bi-monthly, to start at least.
There was a lot of stuff that could have been on the agenda today that's not.
I honestly thought that the orientation was going to take quite a bit longer when I saw the initial consent agenda when it was posted. So that it is a fair statement. Because I thought it was gonna be a little bit longer on that part. I thought we were gonna go into some of the laws a little bit more in depth.
I guess my point is that our meeting started at 12. It was basically finished until we brought this up at 12:16. And we really discussed nothing about the shelter or about anything that is concerning to the public. And maybe that's not what y'all think the role is of this panel. So that's what I thought the role was of the panel, was to discuss things so that we could make recommendations to our elected representatives. We're all appointed. Y'all have firsthand knowledge of what's going on. We don't. So I would assume.
I would also invite
that-
you to, have you been to the shelter since our last meeting?
No, I have not.
It has always been recommended for people that have been sitting on this.
Oh, it says you have to volunteer. Granted, I haven't been out there.
So that's the one thing that I'll always say on our committees is that, except for, even before that, I would go before I was even under contract, because I've been on this board prior to any commitments with the city contract. And I took over that city contract from Dr. Henderson as he was looking to step down and move on to other things. And, I put in a proposal for that, and that was that. I didn't go actively trying to replace anyone on that part.
Well, I don't think anybody has suggested that at all.
But no,
I'm
just
saying
more
that y'all
saying
have a
that
better
part. But
idea of what goes on at the shelter than he does or I do or whoever else the members
But
are
what
here.
I would like to say is that before that, I would go out there and I never saw another board member.
I think that's kind of a gotcha statement.
No, I'm just more
I mean,
saying that
really.
I would encourage you to have for all the board members. And it's not a gotcha statement. It's more of, if we're gonna have a conversation, if you want to have conversations with that, with shelter conditions for any reason, and if we're going to be discussing the temporary shelter, if we're going to be discussing that, I would just like to encourage that if you haven't gone out to the shelter, that you should. And because one of the things that I see when I see people that come in for public comment is that a lot of them have come out to the shelter very few times. And I just want to say that as a suggestion that if you do wish to help with criticism, to make a positive construct, going out and seeing the facility, going out and seeing the people that are working there, the shelter staff, and seeing the interactions that they have. I just want to say that those allow for you to see the human side of a environment. And it's very easy to say things are, they're not according to what we want. If you've talked to anyone at the shelter, you'll hear the chronic statement of there's underfunding, they're chronically short-staffed, the ACOs are going out and people say, why didn't they get to these 12 loose dogs? And if you have talked to an ACO, you'll find out that it can take easily an hour to an hour and a half per bite case. The city approves them from 8 to 5. That's just one thing that I've gathered. Not part of any part of my information, not part of my deal, but just by simply having interacted with the staff and knowing that. and knowing those other things, those are kind of why I have some of those opinions about carrying on that conversation. And I honestly, if you must know the organization that you're talking about, you must know that. And that's why I feel that as part of the advisory board, it is very important for our members to, you don't even have to volunteer. You don't have to go out and clean a kennel. You don't have to go walk a dog. You don't even have to, tour the whole facility. You don't have to do that. But simply going out is important. And having known that, I just want to say, if we want to have a conversation more in depth, just reading off data is not necessarily going to answer that question.
No
If
one
I
is
may-
challenging your commitment.
No, I'm not,
Or your
I'm not
intention.
saying the commitment.
Not a bit. Let me finish.
Okay.
If I may allow us the opportunity to focus on the agenda item that we are discussing, and that is the discussion and possible action related to 2025 meeting dates. Thank you.
Sure. With that, I think there's been a suggestion to make the comment to go to bi-monthly meetings.
Yes.
Do I have a motion for that?
I'll make that motion.
Do I have a motion to second?
Second.
All right, motion carried.
We'll need to take a vote, please.
Can I have a vote? All in favor, say aye.
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 All opposed?
Nay.
No.
All right. Motion carries 5-2. And then any other administrative issues? Okay. Do you have a motion to adjourn?
I'll make that motion.
All right. Do I have a motion second? Second. All right. Meeting is adjourned at 12:37.